we've talked about medication. Medication for some is an option, and for some it really does work well. I go back to the diagnosis. ADHD is a pervasive pattern of inattention and or hyperactivity, impulsivity. So when we're talking about the spectrum, mild, moderate, severe, medication can really, really help with improving the quality of life. But it's one thing to medicate, but then there has to be the training and education and insight. So psychoeducation is important. Helping an individual understand the way his or her brain works. Why what is happening, and what can be done. So that's the psychoeducation, the neurology of it, why it's happening, and how it's perceived through the body and brain. So then there's behavior therapy, empowering the person with the tools for executive functioning, for navigation, for structuring his or her environment. Group therapy, to see, well, first of all, that you're not alone, to build the coping strategies, and also to test these strategies in a group situation where you might be prone to cross-talking, impulsivity in a safe space. This really works very, very well for children. The occupational therapists use a brilliant program called the Zones of Regulation.
Zones of regulation helps children understand their feelings, their energy states, and their emotions by tying it into 4 different zones. The blue zone teaches children that your body's moving more slowly, you're tired, you're sick, you're sad, and it helps you to be aware of what your body's feeling. So it's moving slowly, your limbs are feeling heavy, you kind of have a foggy head. And then it teaches you strategies that you can do to get out of the blue zone, because maybe right now we need to be in the green zone. So stuff like eating something crunchy or drinking water or stretching or standing kind of helps you get out of that blue zone piece. The green zone is that optimal state of arousal. It's, you're focused, you're energized, your muscles are relaxed, you're really comfortable, you're ready to learn, ready to engage. And it teaches you that by getting enough sleep, eating healthy, making really good choices with loved ones, helps you to stay into the green zone. That yellow zone and that red zone are a little bit different. This is when your muscles are getting a little bit tenser, your heart rate is increasing, and how can we learn about what our body is right now? When we learn about these zones, we take deep breaths, we do positive self-talk, maybe we need a fidget in our hands to help us. Different things. It helps us really identify where our body is and how we can get to the optimal zone when we need to complete a task or complete a demand. This program is so good because it ties in a really nice emotional control piece, and that's a big part of ADHD, understanding where we are emotionally. It talks about your inner critic or your inner coach and how you can identify that positive self-talk with yourself. It teaches you about size of the problem. Sometimes our reaction does not match the size of a problem. Sometimes kiddos have a really big reaction to a small problem. So it really helps with these concrete lessons and takes it back to how kiddos can identify, yes, okay, I'm in the yellow zone now, but I'm about to walk into class after break time. I need to get into the green zone in order to learn about this math class coming up. We want kids to be able to make their own toolbox and pull tools from it when they need and when they can identify what zones they're in. We always tell parents, the kiddos under 7 years old, it's okay if you help them with their tools. But when they're older, we want them to become independent with picking the right tools for them. As adults, we know how to pick our right tools. We'll drink coffee, we'll exercise, we'll go for a walk, we'll listen to music. But sometimes for kiddos, they might need that extra support. So with this Zones of Regulation program, they are able to make their own toolbox that works for their body and identify the zones that work for them.
Audience is your girl Giselle Mary Juanita Alvarez, the president of the Red Woman Association, coming to you. Well, here what's going on now. Well, you always meet me everywhere in the market, in the taxi, wherever I go, telling me when all you're doing new thing, we want new work. Well, to do the new work, we need money. So here what? Go to all our channels on Facebook, YouTube, Instagram, like, share, subscribe, and don't forget to go to our webpage, causeandeffect.co, and press that donate button and donate us so we could keep bringing all of this educational content. See you soon.